Welcome back to another episode of Health Matters with UN News, live from New York. I'm your host, Dexter, and today we're diving into a pressing global health issue, malaria.
That's right, Dexter. With World Malaria Day just around the corner, the WHO has made this morning a strong call for revitalized efforts to end malaria.
Exactly. It's amazing to think that since 2000, nearly 13 million lives have been saved through global collaboration.
Yes, and they've reported preventing over 2 billion cases. But the situation remains fragile, especially with the recent uptick in malaria cases.
Absolutely. Dr. Tedros from the WHO highlighted that when we divert our attention, malaria can easily resurge, hitting the most vulnerable populations hardest.
And that's why this year's theme, Malaria Ends With Us, Reinvest, Reimagine, Reignite, is so crucial. It's a call to action for renewed political and financial commitment.
Right. Investing in new interventions like malaria vaccines is vital. I mean, Mali is set to introduce these vaccines alongside 19 other African countries.
That's a huge step forward. These vaccines could save tens of thousands of young lives every year, which is incredible.
And let's not forget about the new generation of insecticide-treated nets. They accounted for nearly 80% of all nets delivered in sub-Saharan Africa last year.
Exactly. But despite these gains, malaria still claimed nearly 600,000 lives in just 2023. The African region bears the brunt of this burden.
It's alarming. Factors like climate change, conflict, and poverty are making it even harder to combat this disease.
Not to mention the funding cuts projected for 2025. That could derail a lot of the progress we've made.
For sure. The WHO's recent assessment showed that over half of malaria endemic countries reported disruptions to their malaria services.
It's a wake-up call. We need to protect the hard-won gains and ensure that at-risk populations can access the services they need.
Reinvesting in primary health care is essential, and the successful replenishments of the Global Fund in Gavi are vital for financing these programs.
Definitely. Plus, we need innovative tools and strategies to address the challenges we face in malaria control.
And more countries are prioritizing malaria control, like the recent Yaoundé Declaration signed by African health ministers.
That's the leadership we need. Everyone, from community health workers to researchers, must rally together to curb malaria.
So, as we approach World Malaria Day, let's remember, we all play a part in ending malaria.
Absolutely. Let's reinvest, reimagine, and reignite our commitment to this cause.
Thanks for joining us today. Let's keep the conversation going and work together to end malaria.
Until the next time, stay informed and engaged with our news live from the United Nations HQ in New York.